Toitoi Manawa, our Tāmaki Hub, is a holistic hauora space, and it came about through COVID. When COVID came about, we entered into that program and created a vaccination clinic around 400 metres down the road from here. And through that process, we saw a lot of people, whānau, non-whānau, the communities we serve down here in Tāmaki Makaurau, East Tāmaki, not far from our marae here in Ōrākei. And on the back of that, we decided that we could do other things in hauora. We actually are part of a rōpū throughout Tāmaki Makaurau, a whole bunch of Māori providers, community providers, marae providers, in what we're calling the Māori Food Network. And we have a taumata kōrero organisation that gets together, and the main kaupapa for that is kai, and kai available for whānau who need it. So this hub here is the Puku Kai Hub for taumata kōrero's approach to getting kai to whānau who need that.
Through here is our hall. We would usually use this space for events, and in other times we've packed kai boxes in here. So we're part of a Māori network of providers, and we pack on behalf of 16 other providers across Tāmaki, all the way from Te Hana through to Port Waikato, and all of the kai boxes that we deliver goes out to whānau. So this is what the space is being used for. And also eventually we want to turn this space into an event centre as well as a resource centre in the back. And the resource centre is where we would gather resources for whānau, anything that they might need for their homes. We plan on turning this space over here into a resource centre so the community can come and get what they need without needing to make big purchases, especially with the cost of living at the moment. This is where we store all of our kai and all of our donations that we get from key partners. So for example, we were giving first aid kits by St. John's, and those first aid kits have been going out to whānau that were affected by the floods.
The outreach from this hub, that we can go into people's homes, the people who can't make it to the doctors or don't want to go to the doctors, they can walk in here, or we can go to them at their house and give them care where they need it, when they need it. Te ao Māori, mirimiri, rongoā, those practices which are now being recognised in our health system are present here. We have mirimiri available, and on the back of that mirimiri there's also whitiki kōrero, where we can help people with the way they're feeling. We have our whānau navigation service operating out of here as well, so whānau can come in and talk to people about how things are going and also their health.
We had an opportunity offered to us last year. It's a program called Earn As You Learn, and it comes through University of Auckland, and they've partnered with Māori health providers, and they offered 3 of us the opportunity to study to become enrolled nurses, but also get paid at the same time. So our fees are paid for and we get paid our normal wages, so it's like we're working full time. Getting paid to study was a huge thing. I would never study otherwise. I never ever saw myself in healthcare. I'm the oldest of 5. When my mum passed away, I took on my siblings, and so I would just stay home and look after them. The only reason I jumped into healthcare was because of COVID. I saw the opportunity to work for my iwi. We were the frontliners. My goal jumping into the Earn As You Learn program was to implement any experience that I have firsthand, kind of change or make things better. In future, I definitely see myself staying in healthcare.
The Whānau Engagement Hub is a central point of contact for whānau and people of Tāmaki to call in if they need support with hardship and queries for whānau, and we sort of navigate them in the right direction. We were also asked to help Ōrākei Health Services to help with the inbound phone calls, just to take the load off the reception team up at the clinic to be more engaged with the whānau that come through the doors. Other supports that we help with is the whānau navigation service team, people who are needing housing support or just general social worker support. The OHA grants are grants for Ngāti Whātua Ōrākei Uri members. There's tertiary funds, tutoring funds, sort of navigate whānau to the OHA team up at Whaimaia. We also support with NIB. Ngāti Whātua Ōrākei Uri members get free health insurance through NIB. It's quite a lengthy policy to read through, so we help the whānau member navigate the policy and ensure that what they're asking for is covered, and if it's not, what other support they can get. The distribution team, we connect in with them to get kai parcels delivered to whānau. We sort of work with everyone in some type of way, whether that's just referring a whānau member through or asking for support on how we can help this whānau member.
We go out and we visit newborn babies up to 3 years old. We try and see our babies as early as possible so that we can connect and engage with the families. If we don't get in there earlier, we often do see that these families have either moved away or they've gone with other providers. The good thing about being here is that we've got access to all the other services here on site. This is one of our hubs or one of our main bases that we come back to knowing that the hub is here for them to access CAI, social services, the nurses for vaccines, or whether it's us nurses for the tamariki order. It's really good to have that in Glen Innes, not only for us as nurses but also our families that we see.